The next tool that we're going to talk about here in the neck is the head of the second metacarpal. Your index finger, its punching knuckle. All right, the joint, well, the head of the bone, not the joint technically, because we've flexed the joint. This can be used in much the same way as our IP joint of our thumb without having any finger joints involved. So I can place my hands on the table, keep my elbows down, and slide that head of the metacarpal directly up under and work up the paraspinals the same way. Try not to get in the habit of doing this, where you're firing those extensors to pull. Try to get in the habit of flexing the whole elbow to pull, or if you're on a rolly stool, pushing with your legs to create that pressure. So you're moving your whole body as much as possible. I honestly don't do this one two-handed as much. I tend to pull the head slightly to the side and bring one hand in and pull up. The beautiful thing about this, pulling your hair, is I don't have to worry about direction. I can go both up and down because there's no problem with either direction here, like there was with the pip joints. So I can be in this position and I can pull this up all the way under the occiput, and then I can push back down. Just make passes back and forth. So this can be done just on this paraspinal, so I'm coming all the way down to the top of the scapula basically. Technically I'm also working levator scap up to the occiput, but it can also be done all the way out into the trap, right, into the other shoulder muscles here onto supraspinatus. And the angle can be adjusted based on that person's neck. Sometimes the palm is more pronated, sometimes it's a little bit more supinated, but I want my wrist as neutral as possible. I don't want to be cocking my wrist in funny ways. I would much prefer to move my torso. So if I'm finding myself like this, I'll move over here and use my wrist in a much straighter position. Just like the IP joint, I can use this for static pressure. So if she, like everyone else on the planet, has a knot at the top of the scapula where levator attaches that superior angle, I can put her head off to the side, take that knuckle, drive right down in there and hold some static pressure. Right? I can do that on this side so you guys can see too.
All of them on the side.
So I'm using that head of that second metacarpal, and I'm just dragging up and down along the paraspinals, just like this. Right. I can also drag that out into the trap or supraspinatus, and it's bidirectional. I can pull up and push down. I don't have to release. I can also do static pressure where I just come in and find that tight spot at the top of the scapula and apply that pressure right down into the scapula. I want to try to keep my wrist as neutral as possible and adjust my body to maintain that. So if I'm working under the occiput mostly, I'm probably coming more to the corner to apply that pressure up and underneath. And just let me know if I dig too deep here, Carolina. Likewise, if I'm pushing down into levator, I may come more to the head of the table and apply that pressure. And as much as I can use my whole torso, and you'll notice I wrap my legs around the table all the time, I'm pulling with my legs to pull my center forward. If I'm doing a pulling up technique, then I may actually be pushing myself away from the table, whether I'm wrapped or not. So that's that second metacarpal head. As with all neck work, we're generally going to stay behind the SCM because that's the safe zone for lots of manual pressure. If you get in front of that, you start pressing on the phrenic nerve, and it's not good for the body. You'll drop heart rate pretty precipitously. The phrenic nerve stimulation is actually used in surgery when somebody's heart is racing. They get tachycardia, and they're, for whatever reason, unable to give them the normal drugs that they give to drop heart rate. They'll have a nurse come in right in front of the SCM and just stimulate the crap out of the phrenic nerve, and it will drop your heart rate. So it's good in that situation. You really don't want your patient going hypotensive and passing out on the table from low blood pressure. So stay away from the front of the SCM, but that knuckle can be used all the ways you were just using this knuckle and these knuckles, essentially. Does that make sense? Good deal. I will use the other side of that knuckle or the other side of the hand rather, that fifth metacarpal head in the neck as well. I'll do it on this side first. Generally, if I'm going to use that one, I'm actually reaching across. So I'm holding the head with my right hand and coming in to press down into the shoulder with my pinky knuckle on my left hand. It's the same basic idea. I'm pressing into that levator scap insertion. I'm just using the other end of my fist. It really just depends on the shape of the neck. So if I'm doing that on this side, reaching over, pressing in just like that.
Are you stretching her neck or are you just holding her?
Well, she's getting a little stretch. That's not necessarily the goal. You certainly can stretch with this. Keeping the shoulder down is the most important part to do the stretch, whatever I'm pressing on. But I'm really more worried about just getting into levator and its insertion. So on her neck, that was this fifth metacarpal head. Yep, the pinky punching knuckle and the index finger was the first one. The wrist in its neutral position isn't actually straight. Our wrist has a little bit of what I call ulnar deviation, what you may have learned as adduction in the wrist. In anatomical position with the hands like this, it has a little bit of a deviation towards the midline. Of course, as soon as you're in a normal position, that's away from the midline, so it's confusing. So I just call it ulnar deviation because that's always towards the ulna, no matter where I put my arm. So ulnar deviation versus radial deviation. We have a lot more ulnar deviation naturally, about 60 degrees, and the neutral position of the wrist is slightly ulnarly deviated. So getting that first knuckle in, I don't have to worry about my wrist being locked straight. A little ulnar deviation is neutral. I just don't want to be extremely ulnarly deviating. So that's our first and or fifth metacarpal head. There is a technique to use that, or second rather, not first. I always do that. Your thumb is technically your first digit. The second metacarpal head can be used on both sides in an alternating fashion. In Tai Chi, they call it Pobo shoot tiger. You're making these little circles like this, and it's exactly the same working on a table. I'm just going to slide up under. Actually, I'm going to put a little more lotion on your neck. If you are using gloves, you'll notice you need just a little more lotion than you did bare skin. They're not quite as slippy as your skin is. So I'm just going to reach in under her neck like this, and I'm going to make circles where my hands are at different spots in the circle on each side. So she's going to feel a little bit like a bobblehead. She's going to shift side to side. That's actually a really good thing for those cervical vertebrae, to gently move them through lateral flexion like that with a little bit of rotation. It shouldn't be super painful. And I'm not applying a huge amount of pressure. I'm not trying to crush her. I'm just trying to get a little bit of motion in the cervical spine. Just like this. And technically, I can pull up the neck or I can push down. 6 of one, half dozen of the other. I can go this way or I can go this way.